following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
This Social Security measure gives at least some protection
for anybody to hand this out. We're asking for a chance to have the people who will receive the benefit to earn their way. The same principle established under the Social Security system in this country.
It is no longer acceptable to discuss women's rights as separate from human rights.
I know we can come together to face down the challenges of our own time.
Hello, everybody, and welcome again to another edition of Us Democrats here on Access Nashua. My name is Dave Tenza, chair of the Nashua Democratic City Committee, and we are thrilled to have with us today Mike Pedersen, a candidate from Ward 5 here in Nashua. Mike, thanks for being with us.
Thank you, Dave. Thank you for having me.
Absolutely. Mike, tell us a little bit about yourself to begin, for people who maybe aren't familiar with you. We in the National Democratic City Committee are very fortunate. You're a very active member and a valued member of our team. You do so much for us. But tell us a little bit, you're not originally from New Hampshire, but you lived here for the last 20 years, at least?
21 years. I've been a resident of New Hampshire. I am widowed with 3 daughters. I'm a retired software engineer and lived in Nashua since 2009. And
you came here to work in one of the tech jobs.
True.
Brought you here in the 90s.
I worked for many years for Cabletron Systems, which then became Enterasys Networks, and that was a good experience. It was a nice job, earned a decent living, and I'm happy that I went to work there. Also, you mentioned about being active in the Democrats. One thing I'd like to do is help my fellow Democrats get elected, because I think that's an important contribution to society. So I put a lot of my time in helping others, and this time around I'd like to get myself elected to advocate for the people of Ward 5.
Yeah, that's great. And Ward 5 is I don't want to say it's a big ward, because all the wards are about the same, but it's an important ward on the city. It's actually, are we in Ward 5 right now?
Yes, we are in Ward 5.
Close to it. And it kind of goes from the police station out to the Hollis line. So it's all...
Well, that's one direction, and it's sort of pie-shaped all the way out to the Massachusetts border, a slice of pie.
Okay.
So out to Hollis and then south a little bit towards Massachusetts.
Great. Like I mentioned before, you're very active with the Democratic City Committee, which we appreciate. You're also active in your neighborhood crime watch, which I think you're even more active in. Tell us a little bit about that.
Well,
in your involvement in getting that started.
We have 2 crime watch organizations in our neighborhood. One is a nonprofit. It's called the Trestlebrook Community Crime Watch Organization, and the Trestlebrook Crime Watch Group. I think the group is the most active out of the 2, even though the organization is a 501c3, and I put a lot of work in to get the IRS to approve that, and I think that's an indication of my attention to detail and my ability to pour through legal documents and read all that boring IRS paperwork and get something done. So,
great. And you were the first crime watch group to get the 501c3 status in New Hampshire?
That is true.
Great. And so you've decided this is your second time running for state representative.
It's true.
You ran first in 2012. What was your first attempt at
That is true.
politics?
And as I mentioned earlier, I've been helping a lot of other Democrats get elected. I think in 2012, I perhaps put too much time into helping my fellow Democrats get elected and did not really speak up much on my own behalf. And so I lost by just a little bit, 3 percentage points, like 70 votes. I think this time I'll be more diligent about advocating for myself rather than others, because I know I can do a good job for the people of Ward 5, and I should be up there in Concord. So I'm going to make sure that happens this time.
Great. And so let's talk a little bit about that. I mean, what was your motivation for running this time around? And, you know, if elected, what do you hope to accomplish for the people of Ward 5?
Well, for the people of Ward 5, I feel as though when you go to Concord, you're making policy that others are going to have to live with, and you have to take that into consideration that, you know, you're working on behalf of your constituents, and you're also handling their tax dollars. So it's not your money to spend for you to push through your pet projects or whatever. So I think, you know, we need fiscal responsibility and accountability, as well as listening to what your constituents want to do up there. And I think the other reason for me coming back this time is I know the House and the government up in Concord, the House and the governor, switched over to a slight Democratic majority, and the Republicans have said time and time again they want to undo everything that was just done in the last few years and go right back to the Bill O'Brien days. And former Republican House Speaker Bill O'Brien vowed to come back and reinstate everything that he did.
Sure.
And basically what he did was undermine access to health care, undermine social services, cut back on public education, and hurt us with, like, for example, we lost a lot of revenue because they took away the tax on cigarettes, and the only thing that happened was the cigarette companies just made up the difference by increasing the price.
Sure. And you know, certainly being the second largest city in the state, we feel those cuts here in Nashua more than other rural communities do. We bear the burden, we'll say, of a lot of the social service needs for people just because they're attracted to the bigger cities like Manchester, Nashua, Keene, Portsmouth, Concord. So, you know, a cut to social services might not mean something from a representative from Mount Vernon or his constituents, but certainly those cuts that you mentioned before to social services, to education, really negatively affect us here in Nashua. So that's not just a Ward 5 issue, but certainly citywide, something that people, not Democrats, but people are concerned with.
True. If you have a population of people in need of services, whether that's health care, mental health, food, money, when those cutbacks takes place in the state, it's the city and the local services that are strained to try to fulfill that gap.
Right.
So I think you can't avoid the problem by not funding it. Those people are still, you know, having a hard time, and when they do have a hard time, when they don't have access to health care, mental health, drug treatment, or other important services, society is going to feel it one way or another.
Right. You know, and we saw it here in the city, and I think across the state and probably across the region, from, you know, because of a lot of cuts that were made in 2010. Certainly the armed robberies that were occurring here in Nashua spiked, unfortunately. Burglaries have been up, and these are people who, like you said, are in need of services, not getting them, and then acting out in these ways. So even if you don't have someone who are you know, directly impacted by someone with a drug addiction or mental health services, you could be impacted other ways, which negatively affect our communities. Are there any, you mentioned trying to keep all of the great things that the governor and the House have been able to accomplish over the last year and a half. Are there any issues in particular that motivate you or you're concerned with in pushing or being a part of up in Concord?
Well, there have been some significant accomplishments over the last 2 years, basically repairing a lot of the damage that was done during the O'Brien era. And one is the implementation of the Affordable Care Act, providing accessible, affordable health care to people who need it. And under Governor Hassan, we've managed to come up with a compromise implementation of the Medicaid expansion for that that window of people who are not too poor and don't make too much, and they sort of fell through the cracks with the Affordable Care Act, and as part of the Supreme Court decision regarding the Affordable Care Act. So the Democrats managed to come up with a plan that accommodated the Republicans' input, and I think with enough discussion and compromise, we can hammer out future compromises that will satisfy everyone's needs, meaning services plus effective cost containment.
Sure, and that Medicaid expansion is a big victory, I think, for everyone in the state. Something that the hospitals wanted, it was something that the business community wanted, and fortunately, the House and the Senate Republicans and the governor were able to work together to get that done. And
as of today, we have approximately 50,000 more New Hampshireites who have health insurance that did not have it before.
Right.
Between the Affordable Care Act and the Medicaid expansion.
Sure. And Medicaid expansion has just started up in the last couple months, so hopefully as time goes by and more people are able to sign up and get coverage, it'll just better the lives of so many people. And you mentioned this before, it's working people who are trying to get by on minimum wage or just above minimum wage, trying to raise their families. They're the ones who are really being given access to health care that they haven't had before just because they've been priced out of the market.
Sure. And I did see Sunday's Nashua Telegraph. There was a letter to the editor written by a lifelong Republican from Hudson saying he's self-employed. His insurance rates have dropped by like $600 a month. Now he's in the 400 plus range every month to pay for his health plan. He had a choice of 21 different plans that he could have selected from. He's totally happy with his health insurance and the price of it. And as a lifelong Republican, he can't understand why his party is so adamant about depriving people of access to affordable health care. I mean, aren't we in the same team? Why are you doing this? And I'm sure he won't switch parties, but he sure is happy with the health care that he's got. And my neighbor has some pre-existing conditions. He lost his job, and he looked at the COBRA plan from his company. It was like over $1,000 a month. Now he has Obamacare, or the Affordable Care Act, for less than $500 a month for he and his wife, and he's not being rejected for pre-existing conditions, which with a normal health insurance plan, he could be flagged and dropped.
Sure.
So he has those protections, and that's something you can't take for granted. You have to work for it up in Concord to make sure it stays in place.
Sure. And I think you're absolutely right there. And I thought, and you can know this too, I thought 2012 was the referendum on Obamacare, and then after President Obama won re-election, then it would kind of go away. But I think Republican officials are trying to make the Affordable Care Act worse than it is, and again trying to say that Americans are so unhappy. But the more people who have these individual stories about how the Affordable Care Act has helped them, the more people I think are starting to see that this is a great program. Certainly the rollout wasn't perfect, but it's something we need to work on and need to keep working on so that it works.
Well, there's always room for improvement, but it's met everyone's expectations to date, and all those dire predictions that you heard from the Republicans, none of them have materialized.
Right.
And one little thing goes wrong, and they're ready to jump all over it and blow it out of proportion. And if you listen to the words out of the Republican senatorial candidate and the Congressional District 2 congressional candidate, Mara Linda, the first words out of their mouth is, we have to repeal Obamacare. And I'm thinking, why would you want to do that?
Right. And I wonder, I mean, why? How could you do that now? How could you take those health care benefits away from tens of thousands of people in New Hampshire and millions of people across the country?
Well, they could do it if people voted Republican, and that's the mistake.
Right. Absolutely. We were actually winding down on time here for our segment. If people want to learn more about you or get in touch with you, how would they go about doing that?
People can access me on the NashuaDemocrats.com website. There's a profile of me, as well as my email address. I can be contacted directly, as it's on the screen, PEDERSEN4rep@gmail.com. And you can always call my cell phone number, 603-801-0878.
Well, great. Well, Mike, thanks for being here. And I think that if people want to contact you, I think you'll be coming around door to door at some point this fall to introduce yourself directly to them.
I'll be knocking on your doors. Thank you very much.
Yeah, please answer when Mike comes to your door. Have a conversation. Again, Mike Pedersen, Ward 5, candidate for state representative. Thanks for being here, Mike. I'm Dave Tenza. If you want any more information, please go to NashuaDemocrats.com. You can find us on the internet. We got a nice calendar there with all the events we have going on, or just information about our group. Thank you very much for joining us. This is Us Democrats on Access Nashua.
This Social Security measure gives at least some protection
For anybody to hand this out, we're asking for a chance to have the people who will receive the benefit to earn their way. The same principle established under the Social Security system in this area.
It is no longer acceptable to discuss women's rights as separate from human rights.
I know we can come together to face down the challenges of our own time.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.